We are now going to hear from Richard Cole from the National Hospital for Neurology and Neurosurgery, who is going to talk about the presence of autistic and alexithymic traits in people with functional neurological symptom disorder.
This study looks at the prevalence of autistic traits and alexithymia in an outpatient FND program. And just to recap on FND, we know it's a multi-network disorder where neurological symptoms are incompatible with known pathology, and it's associated with network disturbances involved in attention, self-agency, interoception, and emotion and threat processing. Alexithymia is a construct referring to difficulty in identifying and describing emotions. In terms of what we aim to do, as well as report on the prevalence of autistic traits and alexithymia, we also wanted to look at whether they were associated with increased symptoms of depression, anxiety, social phobia, and somatic symptom severity. And one of the reasons for this is that differences in interoception and sensory and emotional processing are common to both FND and autism, as are higher rates of alexithymia. We also felt that undiagnosed autism may add or increase vulnerability to stresses which could precipitate or perpetuate FND. So 91 patients in the outpatient FND program completed self-report measures of autistic traits, alexithymia, generalized anxiety, depression, social phobia, and somatic symptom severity. We found that 40% of the group scored 6 or above on the AQ10, which is the clinical cutoff to warrant further assessment for autism, and 40% scored in the alexithymic range. Then when we divided the group between those scoring 6 or above on the AQ10 versus those scoring below, we found that the group with the higher number of autistic traits reported significantly higher levels of alexithymia, generalized anxiety, depression, and social phobia. When we compared those with or without alexithymia, we found that those with alexithymia reported significantly higher numbers of autistic traits, as well as degrees of anxiety, depression, social phobia, and somatic symptom severity. So we report new evidence of a high prevalence of autistic traits in an outpatient adult FND group, and further evidence of a high prevalence of alexithymia. Both of these were associated with symptoms of anxiety, depression, and social phobia. Clinically, measures of autistic traits and alexithymia could be important in the management of FND, as if the higher number of autistic traits translates into a higher prevalence of autism, then an adapted communication style would be important to consider within the MDT approach, where communication is a key part of CBT occupational and physiotherapy. It would be important to consider carefully how to relay these findings to someone with FND, especially in a therapeutic context, and also especially considering a higher degree of anxiety and depression, as an additional diagnosis could add more stress. Mechanistically, this study offers a limited insight, but alexithymia, which has been reported to be prevalent in 50% of people with autism, has been associated with impaired interoception, which is an important etiological factor to consider in FND. Future research could explore what mediates this relationship through gathering interoceptive data, and it would also be important to look at outcomes of an FND program compared between those with higher or lower number of autistic traits.
That was absolutely fascinating, Richard. Thank you so much for that lovely talk. So I have to ask, why do you think you might be seeing these higher autistic traits and alexithymic traits in people with FND?
Yeah, it's quite hard to say from this study because we didn't really assess the mechanisms, and we can't really say that participants were autistic, just that they had a high number of traits. But it's probably multifactorial and maybe relates to what Mark Edwards was saying earlier. So people with autistic traits might be more sensitive to novel sensory stimuli. There could be more cognitive and affective biases that underlie it. But it could also at the same time be more so alexithymia that's important here, because we know alexithymia isn't universal to people with autism. It's just quite common in autism. And so it'd be interesting to see if you had people with autism and alexithymia and compared number of functional symptoms in that group compared to those with just autism without alexithymia. But it could also just be more of a kind of psychosocial level where people living with autism, especially if it's undiagnosed, it could be quite stressful living in a neurotypical world, could be more vulnerable to things like trauma because of theory of mind differences. It's probably lots of different things could be at play there. But yeah, it'd be interesting to look into the mechanisms.
Yeah, absolutely. And then just quickly, in terms of practical significance, I mean, you talked about, for example, potentially adapting communication in services for people with FND if there is higher prevalence of autism in that group as well. how, you know, I'm an autism researcher and I'm really acutely aware of the high rates of co-occurrence between autism and other diagnoses, mental health conditions, things like ADHD, hypermobility and so on. And I sometimes think, goodness me, every single medical professional is going to have to end up being an autism expert to do their job, which seems difficult to achieve. And I just wondered if you had any thoughts as a clinician on, you know, how we can sort of upskill people about all of these co-occurrences that are being kind of revealed by transdiagnostic work.
Yeah, I think that's really important. And I mean, I can answer it from a kind of psychiatry core trainee perspective, where I actually kind of feel like all psychiatry core trainees should be more expert on neurodevelopmental differences, just as much as they are on schizophrenia or bipolar, for example. But I think one of the difficult things is that most core trainees get their neurodevelopmental kind of skills or learning within CAMS jobs, and for obvious reasons, but lots of trainees don't really do CAMS jobs. It's not essential now. And so it might mean that people who in kind of adult psychiatry, they might miss neurodevelopmental differences, or it might not be at the forefront of their mind. You know, if they don't look for it, don't see it. And especially with the problem of diagnostic overshadowing from personality disorders could mask it even more. So I think it definitely highlights that trainees should be more aware of it, definitely in adult psychiatry, and they should be making more of an effort to keep up with kind of the neurodiversity movement. That is certainly very relevant in the general population, not just within clinicians. So there's definitely a need for it.
Brilliant. Thank you so much, Richard. Well, I could stay and talk for ages, but we need to move on to our final presentation. Definitely last but not least, we're going to